Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, get peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in today's episode, I want to answer another question from one of my clients, Tanya. So Tanya writes in, "Hi Patrick, my mum is 64 years of age and she went into open heart surgery last Friday. She had an aortic valve replacement. Everything went well with the surgery, her heart is fine, but while she was recovering, the tube ventilator was removed the first night after the surgery around 11:30 p.m. Soon after that, she had to use a BiPAP machine for 2 or 3 days, but it wasn't working because she developed a pneumonia. Now they are saying her kidneys are functioning poorly because they have been trying dialysis for the last few days. They also say her blood pressure keeps dropping back whilst on the ventilator. Yesterday, she also went into atrial fibrillation or AFib. She's also still very sore in her chest, especially with the BiPAP on. Initially, we were told that she would be leaving ICU within a couple of days after the atrial valve replacement, and now it's been over 5 days. How much longer will she stay in ICU? Do you have any suggestions? What should they be doing in order to get her out of ICU sooner? Any questions we should be asking? Much appreciated." From Tanya. So, Tanya, thank you very much for writing in, and I'm going to look at this in very much detail now. So, Tanya, thanks again for being a client, and thank you for writing in. So, the first thing that's important here, Tanya, is it's not uncommon that day 1 or within less than 24 hours after an aortic valve replacement that the ventilation tube or the breathing tube is coming out. That should always be the gold standard because you don't want to keep somebody on a ventilator for longer than necessary. If surgery goes well, if there's no bleeding, if somebody's vital signs are stable, after an aortic valve replacement, sedation is being weaned off. Pain should be controlled with morphine or fentanyl, sometimes with an epidural, but most of the time it's morphine or fentanyl. Then the breathing tube should be coming out. Once sedation is off, propofol is off, then ventilator should be weaned, and then the breathing tube should come out. Again, if your mother is hemodynamically stable and if your mother has no signs of bleeding. Now, there's a bit of a challenge there. You said that the breathing tube came out at 11:30 p.m. There's a little bit of an argument in ICU when you should extubate the time of the day because, if something was to go wrong, you don't really want to extubate or take the breathing tube out in the middle of the night, which is what's happened here. And it sounds like, it might have been a little bit premature. Imagine you're tired overnight already. Now you had surgery, you're sort of coming out of a coma, and now you're on a ventilator, and then you need to start breathing in the middle of the night when you're already drowsy. So there's a bit of an issue there. Maybe they should have waited until the morning, until there's more staff around. Also, in case if you have to re-intubate overnight, there's fewer people around. It's just safer to extubate or remove the breathing tube during the day. That's not to say it can't be done overnight, but most ICUs actually do have policies and procedures to avoid extubation overnight or in the middle of the night. Anyway, that leads me back to why your mum probably went on BiPAP. So she had a pneumonia, or she has a pneumonia. So here's what happens during cardiac surgery, Tanya. When patients have cardiac surgery, they go on a bypass machine, also known as ECMO machine. Now, what's happening during bypass or ECMO? The lungs are collapsed. And when the lungs are collapsed, right, the risk for a pneumonia to develop is so much higher because alveoli are collapsed and gas exchange, taking in oxygen and breathing out carbon dioxide, is just so much more difficult after the lungs have been collapsed for a few hours, which could have also been another reason why to keep the breathing tube in for a few more hours, because there is some ventilator function that's called PEEP, P-E-E-P, that keeps the lungs open at the end of expiration, and that really helps to open up the collapsed parts of the lungs and potentially could have avoided your mum developing a pneumonia. But it's too late now. She is on BiPAP, you know, and you need to deal with, and she needs to deal with that. So also, you're mentioning that your mother had a sustained low blood pressure, and that could be part of the surgery, because during cardiac surgery or open heart surgery, a lot of blood is often lost. During surgery, there's a lot of bleeding, which means blood pressure usually goes down. And then if the blood pressure goes down, the kidneys aren't perfused enough or not well enough, and that's when patients go into kidney failure after open heart surgery, and this is what's happened in your mother's situation. So you mentioned that she is also very sore, which is not uncommon. Again, after cardiac surgery, the chest is basically being cracked open, right? And that is very painful. Now, while your mother was in the coma and on a ventilator with a breathing tube, she would have had probably some morphine or fentanyl, and that would have kept her more or less pain-free. But now that she's off the ventilator, they need to minimize the morphine and the fentanyl because she needs to be awake. But also the BiPAP can be very uncomfortable, and again, that's probably why she's in pain. Also, after open heart surgery, patients have chest strains in their chest simply because of excess drainage. So again, after open heart surgery, there is bleeding, fluid accumulation around the heart, and that needs to be drained, because otherwise patients could end up with a tamponade and blood accumulation or fluid accumulation around the heart that could lead to cardiac arrest. That's why the chest drains are there. Again, they should be coming out after a couple of days at the most if drainage has stopped. But if they're still in, it's very uncomfortable, very sore, and it needs to be managed often with extra endone, for example. But also Panadol can help with all of that. So with the pain management in particular. You have mentioned also earlier low blood pressure. Your mum might be on vasopressors or inotropes such as noradrenaline or norepinephrine or epinephrine to maintain a sustainable blood pressure. Furthermore, you also mentioned that your mother has gone into AF, or atrial fibrillation, also known as AFib. So what happens, again, often after open heart surgery, patients do go into AF or AFib. You got to understand that during cardiac surgery, the heart is often in the hands of a surgeon, of a cardiac surgeon, and they're modeling around with the heart. And because I've seen such a surgery when I was working in ICU as a nurse, I'm not surprised that patients go into AF after open heart surgery, because they're literally having the heart in their hands, and they're fiddling around with it while they're doing surgery. So I'm not surprised that patients end up in AF post open heart surgery. So AF, atrial fibrillation, is also often caused by electrolyte imbalances such as low potassium or low magnesium. Again, that is often a result of bleeding, and sometimes also a result of diuretics such as furosemide or Lasix being given, and that's when patients lose electrolytes such as potassium or magnesium. So therefore, it's very important that after open heart surgery, electrolytes such as potassium and magnesium are being checked regularly. And one way to manage AF or atrial fibrillation is to replace potassium and magnesium. And if that's not enough, medication management is necessary, such as with amiodarone or digoxin, depending on whether it's fast AF, whether it's slow AF. You wouldn't give digoxin if it's slow AF. And another option for treatment of AF is a cardioversion, where an electric shock will be put through the heart, and the heart is basically getting reset, so it goes back to a normal rhythm. So those are all treatment options for AF or atrial fibrillation. On top of that, your mother is on dialysis, and again, with dialysis, potassium levels drop, and therefore the risk for AF is even more increased. Combination of, again, open heart surgery and dialysis and bleeding drops electrolyte levels down, and therefore the risk for atrial fibrillation is significantly increased. Next, with the pneumonia, your mother will need to be on antibiotics most likely. I hope they have found the bacterium for now. I hope they have sent a sputum sample so they can isolate the bacterium for the pneumonia, so they can treat it with antibiotics. Furthermore, after open heart surgery, it would be very good if patients can get mobilized. What do I mean by that? The sooner a patient can get out of bed after open heart surgery, the better it is for the lungs, the less likely it is patients develop a pneumonia. Why do they develop a pneumonia after open heart surgery? Again, the lungs are deflated during open heart surgery. They have to be reinflated. The risk for a pneumonia to develop is very high. That's number one. Number two, after open heart surgery, patients have pain. It's very difficult for them to breathe in properly. And if they can't breathe in properly because of the pain, again, the risk for pneumonia is increased because they can't fully inflate their lungs. And that, again, increases the risk for a pneumonia. Next, also after open heart surgery, your mother should have had an echocardiogram of the heart to see whether the atrial valve replacement has been successful. She should have had an ECG, which I know she's had because somebody must have found in the ECG that she's got atrial fibrillation. Also, what's important whilst your mother is still on BiPAP, to do regular arterial blood gases. I hope your mother still has an arterial line in, so they can check arterial blood gases and check the effectiveness of the BiPAP, so they can see that oxygenation is normal, and also that CO2 levels or carbon dioxide levels are normal on the BiPAP. Also, your mother should have daily blood checks, right? So especially hemoglobin levels are important to look at after open heart surgery. Again, with all the bleeding that's going on after surgery, your mother's hemoglobin might be low, and therefore she might need a blood transfusion. If hemoglobin drops below 7 or 6, she might need a blood transfusion. Also, other important numbers to look for are coagulation results, such as INR, APTT, and again, check platelets, for example, as well, so to make sure there is no bleeding. Also, check the white cell count. With your mother's pneumonia, her white cell count might be increased. White cell count will indicate whether your mother has an infection or not. Obviously, all other vital signs need to be looked at, such as, blood pressure, heart rate, temperature. If your mother has a pneumonia, she might have a temperature. Other things that need to be looked at, as I mentioned before, electrolyte results such as magnesium, potassium need to be checked properly, regularly, and that's all part of the routine checks. Now, those are the type of questions you should be looking for. Talking about mobilization as well, one of the challenges that I can see why your mother may not be able to get mobilized at the moment is because she is on dialysis. It really depends on where her vascular catheter sits. So if her vascular catheter sits in her shoulder or in her neck, she should be able to get mobilized. She should be able to get out of bed. If your mother's vascular catheter for the dialysis sits in the groin, it'll be very difficult for your mother to get mobilized and sit in a chair, because as soon as she sits in a chair, the vascular catheter in the groin gets kinked and she can't have dialysis. So those are the issues to look out for, Tanya. And, I've given you ideas about what questions to ask. But as always, you've been a member of our membership platform, and that's really great. But the best way for you to get all the right answers, and also for us to help you advocate to get your mother out of ICU, is for you and me to speak to the doctors, and we can set that up. That is the shortcut to give you faster results and help you faster to get your mother out of intensive care and get her the right care and treatment. The biggest challenge, as I always say, for families in intensive care is that you simply don't know what you don't know. If you don't know what to look for, if you don't know what questions you need to ask, and if you don't know how to manage doctors and nurses, you're fighting an uphill battle. Again, imagine you would have come into ICU and you would have known not to extubate in the middle of the night. Maybe your mother would have had a few more hours of ventilation with a breathing tube, and then she would have been ready for extubation. She would have had more PEEP overnight, higher pressures, and maybe the pneumonia could have been avoided. We don't know, but again, if you don't know what to look for, if you don't know what questions to ask, it's very difficult to avoid complications, and this is exactly what's happened to your mum in this situation. So, thanks again, Tanya, for being a client. And the question for you, my dear viewer, is how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly, whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insights so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site, intensivecaresupport.org, for families of critically ill patients in intensive care. You can also call me, find phone numbers on the top of the website. Also have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me over the phone via Skype and via email by clicking on the relevant tabs on the top of our website. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.